So the ICMR INDIBE study was carried out, of course, as a national study done in every state in India. The prevalence of diabetes and obesity, hypertension was published 2 years ago, and we released those findings. And you're quite right that South India actually had the highest prevalence. In fact, the highest prevalence came out in Kerala and Puducherry and Goa. These were the three states which had the highest prevalence, followed by Tamil Nadu, Karnataka, Andhra, and then some of the northern states. So you're quite right that southern India had the highest prevalence. But this study which we presented today is an extension of that study. Having reported that the high prevalence of diabetes is there, we started looking at different components. And this particular study looked at the dietary profile of the whole country, and we looked at whether rice consumption was linked to diabetes or wheat consumption. As you know, in the south of India, we take all the southern states, it's predominantly rice eating. And there has been earlier work from our center also, which is, and our studies also, had shown a direct link between rice and diabetes. We confirm that.
This is also largely in line with the recent Ministry of Statistics and Program Implementation findings, which state that as far as Kerala is concerned, the number of, or the percentage of adolescents prone to pre-diabetes is alarmingly high when compared to the rest of the country, 32.2% when compared to the national average of 10.4%. Tamil Nadu not too far behind the national average, 9.6%, while the rest of the southern states follow. Is this worrying to an alarming extent, and why Kerala specifically, if you could help me understand and throw some insight?
Is it worrying? It's definitely worrying, because as we know, those with pre-diabetes tend to progress to diabetes. About 60% of Indians with pre-diabetes progress to diabetes. And as these are growing children in adolescent age groups, definitely as they become young adults in the next few years, most probably they would turn to have diabetes. So is it worrying? Yes. Why is it happening? There's a lot of controversy around that. Kerala, as we just heard, has a lot of diabetes. There are a number of reasons for that. Today we have some data on their dietary profile. There's a lot of saturated fat consumption in Kerala. Their oil consumption patterns are also quite high. There's also socio-economic divide in Kerala. There's not much of urban-rural divide. There is some role of physical activity which is percolating down all the way to children. Stress levels are high. So I think overall, all of these come together, and that's increasing our risk for all of these metabolic diseases.
Absolutely. And Dr. Mohan, if I could quickly come back to you. I know for a fact that we're doing this discussion at a time when dietary habits are under the spotlight insofar as what's causing so many diabetes cases. What's the issue? I know for a fact that your study said Indians get a bulk of their calories from carbohydrates and fats to an extent. Is that the problem really, that Indians simply don't consume enough protein? And how prevalent is that in South India?
It's very prevalent, and it is true that one of the major drivers of the epidemic is actually the excess carbohydrate, and in South India it's definitely rice. 50% of our calories comes from rice. But it also points to a couple of deficiencies that we have in our diet. We don't have enough protein. So if you leave carbohydrate, the next highest consumption is in fat, which again has a lot of calories, as you know. And even if you look at the type of fat, there are good fats and there are bad fats. The good fats are the monounsaturated fats, which comes from nuts, seeds, groundnut oil, and things like that. Fish, which has omega-3. So those are the good fats to have. The unhealthy fats are the saturated fats. Your ghee or butter or coconut oil or palm oil, and these are all very high in saturated fats. So we tend to eat more of the saturated fat, less of the monounsaturated fat, which are the healthy fats, too much of carbs, and less of protein. When you have less of protein, less of fiber also. So all the protective things we have less of, all the diabetogenic things we have too much of.
While we're on the topic of diet itself, I have to also ask you, Dr. Anjana, the fact remains that Indians love their sweets, more so in the south than ever before, and in comparison to the rest of the country. So all of that Mysore Pak and the Alva and the Jangris, is that contributing to South India's diabetes epidemic, so to speak?
Well, if you look at it, sugar consumption is high overall. So we have a recommended sugar limit of about 5% of calorie intake, and South India is way above all of that. A lot of India is part of it, but South India, particularly all the states, have very high sugar consumption. How much is it contributing? It's definitely a contributing factor because it has carb, it has sugar, it has fat, it has all of this mixed together. It's not a healthy part of your diet. So, but is it the largest contributor? Maybe not, because simply your white rice consumption is so large that tends to become the single most important contributor for things like obesity and diabetes.
Interesting insights there, no doubt, and it also helps bust a few myths with regard to diabetes and sugar. But Dr. Mohan, I have to ask you, we're having this discussion also a good half a decade after the FMCG boom became widely apparent, especially in rural India. A lot of discourse surrounding FMCG expansion often talks about both rural and urban, statistics with regard to expansions and business contributed by these two geographies, so to speak. The fact that during the COVID and immediate post-COVID years, you saw a lot of FMCG giants really expanding presence in rural India. Has that, in a sense, also contributed to unhealthy consumption patterns in these parts? And is that also reason to blame for the diabetes onset in these parts?
Absolutely, because most of the food products produced by these multinationals and other FMGs and others who have come in, it's processed foods, ultra processed foods. And when you process the food, you lose that natural food that you otherwise consume. For example, any food which is consumed as natural form, whether it's fruits or vegetables and so on, which don't need cooking even. If you take it in its raw form, it is much, much healthier.
Right.
You take even vegetables. If you overcook it, you're going to lose all the vitamins and minerals and so on. But with respect to these foods which are being pushed to rural areas, your chips and all your other kind of processed kind of foods, they're very high in sugar, in salt and in oil. All of them are not very good for diabetes or for heart health. And that is what is being pushed.
So, Dr. Anjana, I have to ask you then, what's the way forward? As diabetologists and, as key, proponents of this study that you've undertaken here, at the MDRF, what's the way forward? Is it purely a dietary overhaul? Are there other factors involved? Given the fact that South India, which usually has better health indicators when compared to the rest of the country, is well and truly at the heart of what is no doubt a worrying situation. What's the way forward really for these states?
So let me start with the diet, because that's what we've shown in this paper. What we're talking about is reducing just 5% of the carbohydrate intake with protein. So it's as simple as that.